Welcome. I am Terry Tropin, and today I'm discussing coding for burns, corrosions, and frostbite. First, let me introduce myself. I have a master's in healthcare administration informatics from the University of Maryland Global Campus and have RHIA and CCSP certifications. Also, I'm an AHIMA-approved ICD-10 trainer. I've taught health information technology at Montgomery College for over 20 years. I've also written books on coding. These books are study guides that summarize the coding guidelines, which can be very confusing. My books include one on E&M coding, ICD-10-CM, ICD-10-PCS, and external clauses. These are available on Amazon. If you enjoyed this video, please be sure to hit the like button and click on my picture at the lower right-hand side to subscribe. Here's an overview of what I'll be discussing. So for burns and corrosions, I'll talk about the different codes for internal and external burns and corrosions, definitions of terms, the guidelines, how to look these up in the alphabetic index, how to code for sequelae, and external cause codes and toxic effects codes associated with burns and corrosions. Then I'll talk about frostbite, definition of terms, how to look up frostbite in the alphabetic index, and associated external cause codes. Let's start with burns and corrosions. Burns and corrosions are in these categories. T20 to T25 are external body surface, like the skin and the layers under the skin. And these are specified by site. T26 to T28 includes the eye, burns to the eye, and also burns to the internal organs. T30 to T32 are multiple and unspecified body regions. So first, let's define our terms. Corrosions are burns due to chemicals such as drain cleaners or battery acid. The injury may be internal or external burns. These are why these have warning labels. A chemical burn may cause damage to the skin, but also breathing difficulties, dizziness, or even convulsions, depending on what chemical is involved. Burns are thermal, from heat, due to heat source such as fire or hot appliance. And included under burns are electrical and radiation burns, but not sunburns. Notice that the guidelines are the same whether or not it's a burn or a corrosion, but the codes vary. Now, sunburns are not in this category at all. They're in the L55, which is a section specifically for sunburns and the integumentary system. So not coded here. So how do you look these up in the alphabetic index? Well, you find either burn or corrosion, then the subterm for the anatomical site, arm, foot, wherever. Indented under the site is the depth or degree of the burn or corrosion. Most burned areas include codes for the degree, first, second, or third. However, codes in categories T26 to T28 are by site only. This is eye and internal organs. So what are these categories? Well, first degree burns and corrosions are damage to the epidermis or the outer layer of the skin only. This may be described as a superficial burn, you can see from the picture. A second degree burn involves the epidermis and the dermis, so it's going a little deeper. You may experience edema and blistering. The skin is red and moist. And this may be described as partial thickness burns. Third degree burns are even deeper, and they damage all layers of the skin, epidermis, the dermis, the subcutaneous tissue. In this case, the skin is charred, white, and dry. it may be described as a full thickness burn. So we have different terminology for first, second, third. So for the burns and corrosions, we got categories T20 to T28. So the 3-digit category within these categories, the 3-digit subcategory indicates the site. Head and face and neck is T20, trunk is T21, shoulder and upper limb except wrist and hand, T22, wrist and hand, T23, lower limb except ankle and foot, T24, ankle and foot, T25, eye and adnexa, T26, respiratory tract, T27, and other internal organs, T28. Now the trunk, T21, includes specific codes for the chest wall, genital organs, back, and buttocks. So the trunk is all of this. So all of the areas in there are included in the T21 category. Okay, so we have the first 3 digits for the site. And then you have the 4th digit indicates whether it was a burn or corrosion. So the 4th digit 0 to 3 are used for burns. 4th digits 4 to 7 indicate corrosion. For example, T20 head, face, and neck. These are the 4th digit 0 to 3 for a burn of the head, face, and neck. And 4th digits 4 through 7 for corrosions of the head, face, and neck. So be sure and differentiate between codes for within this category that are for burns and those that are for corrosions. The 5th digit indicates the more specific site or multiple burns. That's the 5th digit. The 6th digit indicates right, left, unspecified. The 7th digit indicates initial, subsequent encounter, or sequelae. So let's look at T24 for burns and corrosions of lower limb except ankle and foot. The 4th digit 1 indicates it's a burn, not a corrosion, and that it is 1st degree. 5th digit indicates this is in the thigh. 6th digit indicates right thigh. And the 7th digit indicates this is the initial encounter. So there's a lot of information in this code. Now the eye and adnexa is T26. Codes in T20, T25 that we just talked about are by site and degree. T26 are coded only by site. So you have burns and corrosions, and burns are 0 to 4, corrosions are 5 through 9. So you have very specific locations: eyelid, periocular area, cornea, conjunctival sac, and then with resulting rupture and destruction of the eyeball, very serious, and then other specified and unspecified. So the codes for burns and corrosions are parallel, and it's only that 3rd digit that lets you know whether it's a bone or corrosion. Okay, so internal codes, internal burns and corrosions are reported using T27 and T28. T27 is used for internal burns and corrosions in the respiratory tract. There are specific codes for larynx and trachea, and larynx, trachea, and lung. The 4th digits for burns are 0 to 3. The 4th digits for corrosions are 4 through 7. T28 is other internal burns and corrosions. Codes include mouth and pharynx, esophagus, internal genital urinary organs, and eardrums, and then unspecified. 4th digits are for burns, 0 to 3. 4th digits for corrosions are from 4 through 7. Categories T through T28 require these 7 digits. An A for initial encounter when the burn or corrosion is under active treatment. When the provider is giving follow-up care or checking a healing wound, you use a digit D. A sequelae is used when the burn has healed, but there is a residual condition such as scar. Note that codes in categories T30 to T32 do not use these 7 digits. So here's an example of a sequelae, means scars or contractures or other leftover residual conditions after the original condition has healed. These are reported with the original code for the burn or corrosion and a 7th digit S. You're not going to use a follow-up or a history of code for a sequelae. You're going to use the original code with the 7th digit S. Okay, so here's a practice. If you want to try this on your own, stop the recording and turn it back on when you are ready to check your answer. 3rd degree burns of palm of hand, initial encounter. So you're going to look up burn with subterms palm and then 3rd degree. The 7th character A is used for the initial encounter. So you have T23.359A. So codes for non-healing burns or necrosis of skin are coded as an acute burn. It may be infected, painful, or just not responding to treatment. That's what makes it non-healing. These burns are coded as acute burns, meaning you should continue to use the 7th digit A. When it's starting to heal and it's just routine follow-up care, then you can use the 7th digit D. The guidelines also state that if an injury is infected, use an additional code for the infection, meaning the burn is listed first, then an acute burn, so the burn code with this digit A is first, and then a code specific for the infection. So another guideline concerns multiple burns or corrosions. Coding depends on where they are, where the injuries are. If the patient has multiple burns or corrosions, but they're at the same site, code only the highest degree. If the patient has multiple burns or corrosions at different sites on the body, list first the code for the highest degree and then additional codes for other burns. Another guideline discusses coding when the patient has both internal and external burns or corrosions. Sequencing in this case depends on the circumstances. Which burn is the major focus of the visit? Is it looking mostly at the internal one or the external one? Here is a fairly gross picture of the patient's esophagus after swallowing Drano. So this would be a corrosion. Sometimes the patient has burn or corrosion and other injuries too. For example, a firefighter may have burns and often smoke inhalation. The guidelines state again that sequencing will depend on the circumstances. Which condition is the major focus of the visit? The burn or the inhalation or the respiratory failure or what other related condition there is. Here's another practice. Again, stop the recording to try to code it by yourself. So, scar of right chest wall due to healed 3rd degree burn. Okay, so in the alphabetic index, you look up scar, and then you have sequelae, subterm burn and corrosion, code to injury with 7th character S. So if you look up scar, it's telling you go to the original injury. So then look up burn, chest wall, 3rd degree, and use that 7th digit S to indicate the scar is a sequelae of the injury. So you have T21.31XS and L90.5 for the scar. Okay, more guidelines on sequelae. Patient may have multiple bones or burns or corrosions, but they may not all heal at the same rate. So you may have a current healing wound with a sequelae of a healed burn. So you're going to list separate codes for each with the appropriate 7th digit, whichever for that burn or corrosion, that stage of healing or treatment that it is in. For example, a patient may receive subsequent care for a 1st-degree burn on the left forearm and acute care for a 3rd-degree burn on the left foot. That 3rd-degree burn may be infected or non-healing, and so it's still getting initial care. So in this case, you're going to list T22.112D for the forearm and T25.322A for the foot. So it's okay to have different digits for different burns. We've discussed burns and corrosions for specific sites. However, categories T31 and T32 are used for burns and corrosions to indicate how much of the patient's body was affected, the extent of body surface that was injured. T31 is for burns, T32 is for corrosions. Now, when do you use these codes? Well, the guidelines state you use these codes when the site is unspecified or when there's a need for additional data, such as in burn units. But if you have the information, it's probably a good idea to go ahead and use it. Codes for extent of body surface are coded after the codes for the burn, assuming the site is known. So the 4th digit indicates the total percentage of the body surface. The 5th digit is the percent of this that is 3rd degree. So this relates to this. This 5th relates to 4th. So for example, if 40% of the body is burned and 15% is 3rd degree, you do T31.4, saying burns involving 40 to 49% of total body surface. And of that 40 to 49%, 15% is 3rd degree. So you have a digit 1, T31.41. Of that 40 to 49% of the body surface, 10 to 19% of that burn was 3rd degree. So the 5th digit is part of the 4th digit, but it's being more specific. So how do you know what percent of the body surface is impacted? Well, the extent of the body surface is based on the rule of 9. So you can see from this, each leg is 18%, each arm is 9%, the front of the trunk is 18, the back is 18. Of course, the provider may change these percentages as needed. You can see from the percentages are different for the child. It might also be different if the patient is morbidly obese or has some other other condition that makes these percentages invalid. Here is another practice. In various sites of the trunk, the patient had 10% 1st degree, 15% 2nd, and 32% 3rd degree. All we know is that it's trunk, so we can just use trunk. So turn it off and turn the recording off and try to do it on your own. So let's take it step by step. The most serious burn on the trunk is this 3rd degree. So that's going to be listed first. And then you add up all of these and you get to 57%. That's a lot of the body is burned. In the alphabetic index, find burn trunk 3rd degree, since that's all the information we have. And remember, the guidelines state that for burns in the same area, code only the most serious. The most serious one, of course, is the 3rd degree, so we come up with T21.30XA. Then we're going to do a code for the extent of the burn. So find burn extent, and then 50 to 59%, 30 to 39%, third degree. So that gives us T31.53. Remember that the T31 codes do not include a 7th digit. Now, some codes for corrosion include a note to use another code to identify the chemical involved in the intent. Was this meant to be accidental, assault, suicide attempt, whatever? So you can get more information on this by looking at my video on the table of drugs and chemicals, and that will give you more information about using toxic effect codes. Now, codes for burns and corrosions include a note to use another code to identify the external causes. What was the patient doing? Where was the patient, etc. Burn codes state, use additional external cause code to identify the source, the place, and the intent of the burn. Was this a hot appliance? Was this a camera? Under the corrosions subcategories, you see, as we said, code toxic effects, but it also says use additional external cause to identify the place. So it's telling you only the place where the injury occurred. So that's a little different. This one has a lot more external causes, and this one specifically says place. Okay, so let's talk about frostbite. These are listed in categories T33 and T44. Frostbite occurs when the skin and the underlying tissues freeze due to extreme cold. Now, while it's easy if you go on the internet to find first degree, second degree, third degree, that's not how the coding's done. The coding is superficial frostbite, T33, frostbite with tissue necrosis, T34. So T33 includes superficial frostbite with partial thickness skin loss. T34 is for frostbite with tissue necrosis. Now, there are no specific guidelines in ICD-10 for frostbite, so we're just going to kind of look at the codes and see how they're laid out. So this is pretty straightforward. In the alphabetic index, look up frostbite. The top of the, right under the main term, you see with partial thickness, and it says use superficial, and then it says tissue necrosis, and it gives you the unspecified one. Under that, unspecified code, under that you have all the different anatomical sites. And under each anatomical site, it will say with tissue necrosis. So pretty straightforward. So each category, T33, T34, again includes codes for specific body areas. Head, neck, thorax, abdominal wall, arm, wrist, etc. So very specific sites. And frostbite codes do require the 7th digits A, D, and S, and the definitions of these are the same as the ones that I used previously. So let's do a practice. Frostbite of face, follow-up visit. So in the index, find frostbite face, and don't forget that 7th digit since this is a follow-up visit. And you also need that X because the 7th digit has to be in the 7th place. 1, 2, 3, 4, 5. The X is 6, and this is 7. So if you don't put the X in there, it's wrong because then it will be in the 6th place, not the 7th place. Now, a note under codes for frostbite has an excludes to note. Remember that excludes to means that if documented, 2 codes can be reported. So excludes to hypothermia with other effects of reduced temperature. It refers you to T68 and T69. So let's take a little look at what those are. T68 is hypothermia, and it only has 3 digits. So in order to make that final digit for encounter, you have to use X's. So you could T68.XXXA, for example. Now there's some important notes under here. Use additional code to identify source of exposure, and that's taking you back to the external cause codes. Exposure to excessive cold of man-made origin, exposure to excessive cold of natural origin. Okay, as they were out in the Arctic and they got cold, they got frostbite, or was it from a refrigerator, being locked in a refrigerator or something. There's also an excludes to note that says you don't use this for hypothermia following anesthesia, hypothermia not associated with low environmental temperature, and hypothermia of the newborn. So these, you can't report T68 with any of these. However, there's an excludes to note for frostbite. This reminds you that you can code both hypothermia and frostbite when it is appropriate. Another possible code category to do with frostbite is T69, other effects of reduced temperature. Codes in this category include codes for immersion of the hands and feet, like in nearly freezing water, and for chilblains. Chilblains is a painful inflammation of the small blood vessels after repeated exposure to cold but not freezing air. This category has an additional code note for use additional code to identify source of exposure. And then we have man-made origin and natural origin, just like we have with T68. And there's also still that, again, that excludes note reminding you that you can do T69 and frostbite. While the frostbite codes do not specifically state that external cause codes should be used with frostbite, if you have the information, go ahead and use it. It doesn't specifically state that you should, but it does kind of paint the picture. Remember, that's what we're trying to do with codes, is paint a picture of what happened. So use them if you can. Okay, it's impossible to remember all the guidelines. I suggest you write these notes in your alphabetic index. So in alphabetic index, find the entry for burns and underline the indent for extent. And that way it'll be easier to find it. You can also find unspecified site with extent of body surface and underline that one. That makes them much easier to find. And you do the same thing under the entry for corrosions. Underline the indent for extent or unspecified site. Under the entry for frostbite, look at the indent right under the main term frostbite with partial thickness and with tissue necrosis. In the tabular list, there's also some things to underline. Under the section for burns, T20, T25, circle the definitions of degrees. Circle the note to use codes from categories T31 or T32. Note guidelines for multiple burns in the same or different site. So that might be something you make a little note in there to remind you. In the burn categories T30 to T25, underline the word external. In the category T26 to T28, underline internal. So that's eyes and internal. T20, T25 is external. In the burn category T31, T32, note fourth digit total body surface burned, fifth digit percentage of that is third degree burn. So what we talked about, that's one of the confusing areas in coding for burns. Okay, that completes the video. If you have questions or comments, I would love to hear from you. If you enjoyed this video, please give it a like and subscribe by clicking on my picture in the lower right-hand corner. Here are the books I've written on coding. These are available on Amazon. You can click on the link, or you can go to Amazon Books and type in my last name, Tropin, T-R-O-P-I-N. Thank you so much for listening. I hope to have more lessons up soon. Thank you.